Hello, I'm James Hawes, and this is Christopher Tan. The paper we are reviewing is called Nonrestorative Sleep, and it's from the journal Sleep Medicine Reviews. It is a theoretical review which seeks to standardize the definition of nonrestorative sleep. The goals of the paper, as defined by the authors, are to portray the need for a universal definition of nonrestorative sleep, to provide an overview of empirical findings of nonrestorative sleep, and to recommend a direction for future research. First, some basic facts about nonrestorative sleep. The idea nonrestorative sleep has its basis in restorative sleep theory, where the body and mind are replenished after sleep, giving one a refreshed sensation. This theory postulates that sleep restores cerebral functioning, which would include maintenance of brain mechanisms needed for survival and processing. Hence, grogginess, sluggishness, and fatigue could be due to a non-restorative sleep. While non-restorative sleep theory is defined differently in multiple medical journals, including the DSM-4 and the ICSD, the current oversimplified definitions tend to equate non-restorative sleep with a feeling of fatigue or exhaustion upon waking. Deviations on the definition, such as whether frequency of occurrence and duration of sleep are necessary, have led to huge disparities in the prevalence of NRS. Certain studies have shown the prevalence of NRS in the population to be between 1.4 to 35%, or 16 to 60% of adolescents. Recent research has shown a correlation between alpha-EEG activity and non-REM sleep and NRS, but despite potential links, a cause-effect relationship cannot currently be established, as similar activity also occurs in subjects without non-restorative sleep. Currently, non-restorative sleep is most frequently measured by asking a patient whether they feel rested or refreshed upon waking, but most questionnaires cannot identify non-restorative sleep if they do not use normal sleep duration as a criteria. The sleep assessment questionnaire screens for non-restorative sleep and uses a 4-point Likert scale. The definition recommended by the authors require that 3 primary conditions be present in the addition of a feeling of fatigue upon waking. The feeling must exist in the presence of normal sleep duration. It must persist for at least 3 times a week for at least 1 month, and exist in the absence of a sleep disorder. If a known sleep disorder is present and these other non-restorative sleep symptoms are present, the authors suggest that this be classified as unrefreshing sleep, which would cause non-restorative sleep to be viewed as a unique agent of sleep disorders and not a symptom of other disorders. Ideally, this new definition would also provide a method of investigating non-restorative sleep as a controlled variable and lead to discoveries in prevalence and treatment.
In analyzing the empirical findings of non-restorative sleep, the authors analyzed correlations of non-restorative sleep in sleep frequency, daytime impairment, its occurrence in fibromyalgia and chronic fatigue syndrome, and its demographics. When sleep latency, the time it takes for one to fall asleep, is increased, the occurrence of non-restorative sleep increases. In fact, when sleep latency is increased from less than 15 minutes to over an hour, the prevalence of non-restorative sleep increases from 7.1% to 28.3%. Furthermore, non-restorative sleep has a positive correlation with sleep duration. Short sleepers who sleep less than 6 hours are less likely to report non-restorative sleep compared to that of the control who sleep for 8 hours. Furthermore, those who sleep longer than 9 hours are reported to have a higher non-restorative sleep occurrence. This result is believed to stem from the fact that those who sleep longer than 9 hours are likely to have already been suffering from sleep deprivation or sleep pattern irregularities. Another study showed that those who had non-restorative sleep only, as opposed to having difficulty initiating sleep, difficulty maintaining sleep, sleep deprivation, and pain from arthritis, were less likely to report daytime consequences. However, the restorative sleep questionnaire and daytime consequences sleep questionnaire showed that non-restorative sleep only had much worse self-reported daytime impairment than any of the other groups. Non-restorative sleep is also present in painful diseases such as irritable bowel syndrome and rheumatoid arthritis. The paper examines non-restorative sleep's presence in 2 disorders: fibromyalgia, a disease characterized by chronic widespread pain and fatigue, and chronic fatigue syndrome, a disorder defined by persistent fatigue not related to activity. Both disorders have non-restorative sleep as a chief indicator. 65.7% of patients with fibromyalgia syndrome reported to suffer from non-restorative sleep. Another study showed that 100% of the adolescent chronic fatigue syndrome patients stated that they suffered from non-restorative sleep compared to the 10% of the control. Furthermore, In determining demographic correlations of non-restorative sleep, Stone et al. Determined that age, more than any other variable, was strongly correlated. While the specific age group varies, significantly more young adults, less than 50 years old, report non-restorative sleep more often than those older, and further occurrence decreases linearly with age. In addition, women tend to report non-restorative sleep more frequently than men, although a number of studies have failed to find any gender correlation. While obtaining a universal definition should be the primary aim of future research, the authors also recommend a research agenda once a definition has been made. Research should first focus on developing standard, valid, and reliable measures to assess the prevalence of non-restorative sleep. Once prevalence is established, the authors suggest collaboration on how best to categorize non-restorative sleep in diagnostic manuals. If non-restorative sleep is shown to be prevalent, the author suggests it be categorized as an independent sleep disorder and advise that treatment should be developed through empirically supported mechanisms. If non-restorative sleep is not prevalent, it should be considered a common symptom of most sleep disorders.
This paper could have been improved by addressing the validity of non-restorative sleep as a primary characteristic of insomnia, which is how it's defined in many medical journals. While the possibility is acknowledged, the authors fail to present reasonable evidence that non-restorative sleep may be a condition and proceed to support the idea that non-restorative sleep is a unique agent of sleep disorders. This seems especially surprising, as at one point the authors even admit that there is no significant evidence supporting their claim that non-restorative sleep exists as an independent condition. In addition, the article would have been greatly improved by incorporating a study examining non-restorative sleep prevalence before and after treatment of an associated sleep disorder, which would help give some insight on whether non-restorative sleep could possibly be viewed as an independent acting agent. That is our review. Thank you very much.